Like I said, everyone knows me by now. I'm super happy to stand at this in front of actually the camera, in front of all of you, and thank you one more time for coming. I think it's been a great event as we heard your feedback for now. Hopefully, later we'll give on a survey that, you're going to share your opinion, true opinion. It's going to be anonymous so you can say what you actually think. Um, Actually, I wasn't supposed to do this. I can't do everything, basically. But Mr. Kuchukaya, who is much more experienced on this subject, would be, I'm sure, a much better moderator. But since we have such a great speakers, I took this role and just said, I'm going to give them the main word, and I'm just going to circle some questions because I obviously worked on a program, so I know what it's about. We're going to make it super dynamic. Please feel free to interrupt me, Linda, Irena, anyone from the audience. I would appreciate it, and hopefully this is going to be engaging panel discussions, and I'm looking forward what my colleagues can say. I'm actually coming from the management background of this conference, but I'm sure I have some experience that will be valuable for you too. So enough about me. I would like to just quickly introduce everyone from my panel. Mr. Lotfi Khalifi, can you tell us a few words about yourself? I would majorly like you to discuss how much experience you have in health tourism.
Thank you very much. Thank you for this kind invitation to attend this important event and conference. Thanks for all the colleagues here. I have almost 10 years in this field, 10, 12 years exactly. I started by writing reports about the health tourism. I have been in many visits to many countries, such as Malaysia, Korea, Japan, USA, of course, the Gulf region where I am, the Middle East, the Jordan, and I wrote hundreds of articles about the health tourism, and I focus exactly on the communication and marketing, and how the marketing can play a very good and big role in developing a healthcare system or a health tourism system in any health tourism destination. So I'm publishing the Middle East Health Tourism magazine. Through this magazine, I can say that we get some good experience in this field. Today, I'm with you to discuss how or where it's going wrong, and I think we can exchange ideas about this point, and I am here to answer to your questions and share you the discussion.
Thank you. Mr. Stefan Scherer, he's going to be educator working as a certification developer for Medical Tourism Association. A few words about your experience and short.
Thank you. I've been doing healthcare consulting for over 30 years, focusing on quality of care, mostly in the United States. I've worked and lived in Saudi Arabia, in Indonesia, and Japan, in those areas doing education. I've been with the Medical Tourism Association USA for about 2 years now, doing training and developing products. I would just say that I think the topic is interesting about the issues regarding challenges in medical tourism, but to me the bigger perspective is all organizations have challenges in providing products and providing patient care that works and the patients respond to. So I too am looking forward to the discussion. Thank you.
Thank you. Mrs. Natalia Strokowska, she's an owner and editor-in-chief, Dr. GEO, coming from Russia.
I started my company 4 years ago, in March actually, if we have birthday.
I'm sorry,
Yes.
how many? Just like, you
four,
know.
4 years ago.
Okay.
4 years ago, and for 3 years ago we started to publish our magazine. It's printed issue. Yes, thank you. So we operate in Russian market. It's 4 main countries actually in the medical tourism in Russia, Ukraine, Kazakhstan, and Azerbaijan. This is more richest patients who are active to treat abroad. So we help foreign companies to do a good marketing programs to attract patients, and we discover what ways how a patient make decision to go to treatment to abroad. So I want to share my opinion with you. Thank you.
Thank you. And then last but not least, Mr. Sulail Mohammed. He's a Chief Medical Officer, Gulf Aluminium Rolling, Garmco, coming from Bahrain.
Thank you very much. First, I would like to thank the conference organizers for such an excellent arrangement. Actually, I have an experience over 25 years in medical field. I might not look that old, but I've been working for 17 years for one of the largest aluminum industry in the Middle East as a chief medical officer, and we are actually having our own medical services, which is entirely not related to the government. So we have a small hospital within the camp. This company is owned by the Gulf state, and we provide all the medical services, including overseas treatment, to our employees and families, about 5,000. We have about 34 subsidiaries worldwide. Here today, I might talk about 2 issues maybe I can touch with reputation, because medical tourism in the Gulf state actually started many years, but was in a short form. Maybe I can also touch about the patient needs, especially for the Gulf state, what are the patient needs. Thank you.
Thank you all. Okay, I have one prepared questions, or 2, or maybe 2, 3, but I'm going to start. I would like to point out the case study of India. We mentioned it yesterday. We know India is still one of the top 5 countries where we send our patients to. It's also a wellness destination too, famous for it. And what is the situation there? We know like many bad case studies. We heard the yesterday's case study that Jonathan and Doreen pointed out. So what is the actual opinion on the market about the India? So I would just, maybe all of you to give me the opinion on it.
Well, I think India always demonstrated itself as one of the cheap, medical services in the world. Unfortunately, as experience from Bahrain has been very bad. Last year, we had a record of 10 mortality rate of children who were actually operated for congenital heart disease in 1 year. I think the problem with India is, again, as I said, they have a good doctors and good surgeons, but the infrastructure is not that promising sometimes. So maybe the surgeon who's done these surgeries were good, but then the post-surgical care was terrible. To have 10 babies died in 1 year, it gives you a bad record. So basically, the problem, again, the legal issue there, it's very complicated. You can't follow. So we don't have really such a good experience with some hospitals.
Steven?
I can say about medical facilitators company that is, they operate very bad, because we have they not answer all my letters. They can not receive patients in not invite in the airport or something like that. Not there are no good service for patients actually.
I was going to say that India, like any other country, and I think, as the doctor pointed out, you can have the best services in the world, but if you can't get somebody from the airport to the building, to the hotel, to have that chain we talked about several times this week, the service experience for the patient is not positive, and I think also that doesn't give people confidence in the bigger picture of the organization. If you can't get someone to meet someone from the airport on time, everything's downhill from there. So I think a lot of countries market their service, but don't market the patient experience. And to me, one of the most important things people do in this room is you control the patient experience. And you control that from the moment they contact your website, from the moment that you decide to be transparent about the costs, from, again, the airport and the hotel and the surgeon and all. And I think some countries drop the ball when they don't concentrate on controlling the patient experience. And I think that's been a challenge for India, like many other countries.
I think the problem in India is very clear. They still didn't believe that the health tourism is an industry. So they are still working like 20 years or 30 years before. In India, you cannot find a clear situation and a clear vision about the health tourism. They are well known, they have a long history, but the problem that they don't want to spend money and they don't want to believe and to change the idea that this is an industry which requires so many elements and a certain level of quality, certain level of services. They believe that they can get money from this business, but without spending. And the problem, the major problem, according to me, is to believe that this is an industry or not. This is the point.
So treat it as a business. But my question to all of you is like, how come all those bad things that we listed, how come they still didn't fail? Is that still like the price, how they're the most affordable? That's what is keeping them on the top? Or people still send patients there? We all know that.
It's the price, and as my colleague said, they have good doctors. The problem is not in the doctor itself. It's a chain. So if you find the doctors only, and you know, health tourism is a chain, starting from the first idea and finishing in the end idea in the mind of the patient. To move from a country to another country, it's a process. So it's not enough to get a good doctor. And India, they have a good doctor, okay. They have a different lifestyle, which lead to a very limited cost. And then between good doctor and limited and low cost, is this enough to get patient and to get a good health tourism system? I believe that it's not enough. So the point is that they don't believe in the health tourism as a sector, a different sector, one of the best sources for money and an industry. This is the point.
And if anyone from the audience, okay, Mr. Hamid.
Thank you. It's rather unfair for us to be commenting on India without any Indian representative being here. And me being the closest neighbor, I think I would like to be the devil's advocate over here. Yes, India has had a stake in medical tourism, has made a stake in medical tourism, but perhaps the ambition has not been backed up by a strategy that would have delivered. They have been looking at the West, like everybody else. They've been looking at the uninsured and the underinsured 55 million Americans. They've been relying on the McKinsey and the Deloitte & Touche studies, which were to deliver them an industry worth 10 billion. In 2010, we are now in 2016, and it's nowhere near. They have been looking in the wrong places. Most of their patients have to come from the region. Medical tourism has a regional dynamic. And so their patients were to come from countries like Pakistan, Sri Lanka, Bangladesh, Nepal, go further afield to Myanmar, etc. And if you look at the political scenario, there is a kind of animosity. And therefore, for people to overcome the visa facilities, overcome the barriers to entry, is not something that sits well with providing access to healthcare travel, providing access to healthcare facilities. So that is a problem that India have had. Twice I have been put down as a speaker to go to India and talk about, whatever I have to say about medical tourism. Both times, my visa was issued 3 weeks after the event. Reason? I'm a former colonel of the Pakistan Army. Well, how can they give me a visa? They should have said no. But they wasted a ticket, they wasted the hotel booking, and they denied an outside perspective coming in when I wanted to talk to them about a SWOT analysis of the Indian healthcare travel industry. So tell them about those strengths, weaknesses, opportunities, and threats to Indian medical travel. But to build upon that point, they're looking in the wrong place. They've got great medical facilities. There's absolutely no doubt about that. And they need to concentrate on that. India has a huge middle class. And by that I mean an annual income of something like 25,000 US dollars. Why don't they introduce private medical insurance? Do they have to look outside India with a population that size to fill up their hospitals? I suspect not. So that is where the emphasis is a bit skewed. I'm working with India. I'm still sending patients to India. But they don't tend to go in hordes over there. They're in ones and twos. So that is really the true perspective, the true face of Indian medical travel today.
Actually, you mentioned something we're super interested I can rely on. I had obviously you all know that I was working with buyers program here in regards to the visas. What can we do there actually? I had a Pakistani buyer and we actually at HTI conference wrote at least 10 letters to the office to Austrian embassy, and his visa was approved on the day of event. Big buyer, big company. Then actually the moderator of this panel discussion was rejected for visa in Dubai. Also working with this industry, obviously in healthcare. Also another person from Dubai, big buyer, working with the royal family, Mrs. Rania, I think everyone read about her. She was approved for visa on the first day of a conference too. What is there? Is there something that is creating big issues for the patients for this industry? Is there any way that this can be pushed towards the governments? How we can come in front of the governments? I don't know if you have any kind of experience that is related to, but I've been experienced this, like, it's basically putting a stop on my conference too, on our events and our business-to-business meetings because people just don't get visas, or I don't know, government they don't understand the industry. Do you have anything to say on that, Rat?
Well, I can tell about our experience. We invite embassies and for someone from consultation, maybe for boards, to our conferences and send questions. So what do you do for medical tourism? What do you do for patients? Do you have medical visas? And for example, France embassy, that today they start thinking about it. France have no medical visa, but Germany gives medical visa in 24 hours. From Czech Republic can receive patients without visa and put visa for when patients will be in operating room. So we are starting to discuss these questions and to pay attention of embassies to these questions.
Anyone else? And actually, you actually touched this. I wanted to point out, and I don't think I'm kind of surprised that no one mentioned it before, and it's huge for this industry. What is the influence of migration crisis? Actually, I think it should be the big problem for Turkey. It's a huge issue for the whole tourism industry, and especially for medical tourism. People are not, if you have experience, obviously the Paris trips have dropped by 98% after the Paris attacks. So we can talk about the migration crisis and the terrorist attacks. How is that influential comparing to medical travels?
I was in Jordan last year doing a class, and it was like the gentleman yesterday was talking about the commitment that Turkey has to take care of the Syrian refugees, and I think that it's one of those things we really have to recognize and applaud, that the same way with Jordan, that the numbers of migrants change the culture and change what's available for everyone else in the country. So I think that it changes perspective of outside people who want to have medical tourism maybe in an area like that. But I think it's one of those things we really have to applaud those countries that are providing services to people who are desperate.
Anyone else?
Yeah, I think the immigration, there are two aspects. One, like the migration in the Gulf region, it is the other way around. It's really helping the medical tourism, because like in Dubai and Bahrain and the Gulf state, a lot of people come and stop by there for tourists, and they take the advantage of getting treated, with the hospital there. But the other way around, for the war migrants, like in Jordan and Lebanon, and those countries are really being affected because of the demographic changes, and that has put a lot of pressure on the health services provided for the native or the nationals themselves. So that has a negative impact, and now they are suffering with that. Yeah.